My name is Dr. Mark Stid, and I'm one of the physicians at part of the Holland Hospital medical practices. And I'm here with three of my colleagues today to just address most of you about the issues we've noticed with the increase in COVID-19 infections and some simple things that we can do to help prevent the spread in our community.
I'm Michael Ridding. I work with pediatrics and internal medicine, also part of the Holland Hospital network.
I'm Dr. Chris Howell with internal medicine.
I'm Dan Maring. I'm a family physician at Vigilant Family Medicine.
Okay, so we have obviously started to see an increase in numbers here in Holland as well as across the county, and we realize that it is frustrating and there are a lot of different sources of information. We just wanted to try to give you a uniform set of guidelines to follow. We're going to first talk about some ways to deal with the mental stress and fatigue of COVID-19.
Well, I think that not so much as part of mental stress or fatigue, but I think a lot of people now, this has been going on a long time, but now we're seeing a big surge, a big increase in numbers. And at the same time, there seems to be a less focused approach to staying protected. And I think people need to remember that the virus is out there and we still need to do things like wear masks and stay distanced, and stay outside and not so much inside if you have to meet with people or be in groups, and not let down your vigilance as far as protecting yourself and protecting your family.
And Chris, can you talk to some of the changes that you're seeing in your practice as far as numbers and things that our patients are experiencing?
In March, when this all started, we were all quite concerned and our patients were quite concerned, but the irony is the actual risk in Holland was quite low at that time. And thankfully, our initial outbreaks we could pinpoint to one manufacturer or one plant. Later on this summer, we could say it was one college campus, but many of our patients in the community were at very low risk. But people were really, enthused about doing all the proper things. And as you mentioned, the irony is now that the risk is greatly increasing, people have let their guard down some. And I want to make it very clear that the risk is significantly higher to general community members today than it has been at any point this year. And unfortunately, it may be significantly higher in just another week or two. It's no longer, an illness that we can say it's just the young, it's just this group. It's everywhere. It's in our younger people, but it's also in our seniors. And as an internist taking care of primarily seniors, we're seeing a significant uptick in seniors, both in the community who live at home, in our facilities as well. And it's really time for the community to realize that, it's our turn. We saw what happened in New York City. We saw what happened in South Texas. And I think this is a good opportunity for us to realize this is coming our way and we have time to potentially turn that around if we can get the community response that we need.
Okay, thank you. And Daniel, do you mind talking a little bit about some of the things we can do as a community to hopefully short-circuit this to some degree and with the holidays coming, what precautions we can take so that we're not spreading it to family members and friends as well as the general public?
Absolutely. And spreading it to family members is a big component of this. Early in the pandemic, we would hear a lot about super spreader events, right? Church services, concerts. At least in my practice, what I'm seeing is spread within family households. People bringing it home and the whole household falling ill. And so I think thinking about your family members and how to protect them, especially the older adults and the young vulnerable kids, should be motivating to practice good hand hygiene all the time. Wear a mask, especially when you're in public spaces like gyms or restaurants when you're not seated. And then being mindful of social distancing, I think. We now know a little bit more that particle size matters of these aerosols and that being closer to somebody does increase your chance of spreading the virus. And so being mindful of keeping your distance to reduce the spread is very important.
Okay, so we hope this kind of gives you an overview that we are certainly taking it seriously from the medical side of things, and yet we don't want to scare people. We want to make sure that they know there's things that can be done. We are going to have some other links to other talks for more specific details on things. There's also the Holland Hospital COVID hotline that is listed below that will give you some information on basic techniques as well as some of the testing centers and availability. Thank you for your time.